We all know that stretching is important, but did you know that we're doing it all wrong? We'll talk about this and more coming next. Don't go away. Hi, I'm Laurent and welcome to the show. Today, we'll be talking about pain and how to get rid of it naturally. And who better to talk to than my dear friend, Dr. Jeff Haggquist. Jeff, welcome to the show.
Thank you for having me.
Oh, it's such a pleasure to have you. Before we begin, you are a DO, Doctor of Osteopath.
Yes.
How is that different than an MD?
Well, they're basically the same training. We both are fully licensed physicians. DOs are also trained in manual therapy techniques that MDs are not trained in early in their medical training. They can get it aftermarket, but not initially. And DOs have it going out the door.
Oh, so you're better than a doctor, than like a medical doctor.
I wouldn't say better, but we have some additional training.
Oh, okay, perfect. I like extra stuff, you know. I'll give you a few stats. 100 million Americans suffer from back problems. It costs $600 billion in treatments, which I guess is good for you, right? And also in loss of productivity.
Sure.
It is now considered a disease, bigger than cancer, diabetes, and heart problem combined.
Yes.
What's going on?
Well, it might be sitting down too much. Human beings are movement-oriented.
Yeah.
We're meant to move, not sit. In fact, it's been shown that sitting might be more dangerous than smoking in the long run.
Oh, wow. So it's better to smoke.
Well, in fact, what I've done is I've told all my employees to get up, get out of their seats, and go downstairs and have a smoke break.
There you go. There you go. So you're helping a lot of people that way, yo. So, but you're saying like, a back problem. Let's say we take back problems. Did they didn't exist in
Right.
in the 1,000 years ago?
Well, it's interesting. In fact, personal training is coming around to this way of thinking in that the spine is meant to be in a certain natural posture. And when it's in an abnormal posture, it doesn't support our weight well. And in a gravity environment, we live in a very strong gravity environment.
Right.
And when we sit, you see people, we slouch, we hunch, we throw our hips back. It puts our spine in a very abnormal posture.
Right.
And then we have all sorts of musculoskeletal tension that comes in. This creates abnormal stress, and abnormal stress breaks down our body.
Okay. So if we lived in the moon, for example, we wouldn't have those problems, right?
Well, we might have other problems.
Right, but not this one. So somebody has a problem, a back problem.
Yes.
Why should they go see you versus a chiropractor or a pain management doctor, for example?
Well, for one, seeing a fully licensed physician, it's important to understand the entire picture. I can rule out the worst pathology and understand the entire picture of from the easiest problems to the most complex. Chiropractic is fairly well focused on the spine and mobilization of the spine. As a osteopathic physician, not only do I do everything a chiropractor does, but I also integrate it into the entire body, the musculoskeletal system as a whole, and the organ systems as needed.
Okay, and let's say a pain management doctor. What would they do differently?
Many osteopaths are pain management doctors. Pain management doctors have been pigeonholed pretty much into doing injections and prescribing medications for people in severe pain. As a musculoskeletal and sports medicine specialist, what I try to do is use injections and medicine as a last resort, and actually help the body come into balance and therefore
correct itself,
fix the pain from the root cause.
Versus it just covering it.
Versus treating the symptoms and masking it through medication, sure.
What I want to do for our viewers, I want to explain my story. What brought me to you, how we met, etc. A few months ago, and you remember that, I came to you because I had some back problems.
Yes.
Dull problems in my back. I've always had back problems. I work out a lot. I don't do as much stretching as I should, way back then. But that back problem got worse to the point where I couldn't sleep. Even driving my car was becoming difficult. And my friend Allison, told me, hey, you should go see this guy. He's unbelievable. And what I did is I followed your treatment. And a few days later, I felt much better. And now, which is a few months later, I feel incredible, And I just want to tell you, our viewers, that I'm not selling anything. I would never sell something that I didn't believe in. This is not an infomercial. If you call in the next 30 minutes, we'll give you something for free. This is not what it is. I really lived it myself, and it's unbelievable. But what I want you to do is I want you to share with our viewers, when you met me, like, what was your diagnostic of what you saw in me? Because perhaps somebody out there has the same problem as I do, and perhaps they could take advantage of the treatment that you gave me,
Sure. What I saw when you came in was I saw a very physically fit person, amazingly fit, but amazingly inflexible.
Right.
And I said to myself, well, since flexibility is an important variable in strength,
right,
how did this man get so strong and be so inflexible? Well, the answer is he didn't quite make it there because you injured yourself in getting strong without having the flexibility. So then my job was to figure out how this inflexibility, what actually was in your way from continuing to get strong and work out, and balance your flexibility, balance the muscle pull across your joint, so to speak, put you back in balance with yourself, front to back, side to side. What that does is it takes dysfunctional mechanical stress off your joints.
Right.
And it makes your joints function normally. When they function normally, you're healthy and you're out of pain.
Right.
So you had a very tight lower body, and that's the first thing we worked on, was creating flexibility in your quadricep, your hamstring, and your calf muscles, and then your deep muscles of your hips, to take dysfunctional pull or muscle pull that was too much one side, too much. Your body was in a tug of war with itself on your hips. And then your back was fighting back with your legs, and before you knew it, you had very tight back and compressed lower back. Your spine was compressed because the muscles were so tight, to put it simply.
So what I want to add is that sometimes, people have back issues, which originates really from tight legs, quadriceps, hamstrings, calf, etc. It's not really a problem of the back itself.
Correct.
So
Correct.
It's I guess what happens when those muscles are tight, and the back just kind of
exactly.
Fights against
it. It's a battle.
Right.
And it's battle with the pelvis and the core, and there's a way to integrate the lower body flexibility with allowing good core strength.
Right. Which brings me to my next subject, stretching.
Yes.
My whole life is about inspiring people, motivating people to live a happy and healthy life.
Yes.
And stretching is a big component of it. And I've always, been taught that a good stretch is a stretch that you hold for 30 seconds, you release, and you do it again. But you're saying it's all wrong. Explain.
Well, if we go to how the body actually works, as soon as a body feels a stretch, it automatically contracts to fight that stretch. So if you hold the stretch, you're actually fighting yourself.
Right.
So it would make sense to me to work with your body instead of against it.
Makes sense, absolutely.
Sure. So we can take a law of medicine called the opposite side relaxes. Sherrington's law.
Opposite side relaxes.
Opposite side relaxes, or Sherrington's law of reciprocal inhibition, technically. And
all that technical stuff.
when one side contracts, the other side relaxes.
Right.
So now, if I want to stretch this tricep or back of my arm muscle,
right,
and I want it to truly relax, I need to contract my biceps muscle. And therefore, I'm actually stretching a muscle that's relaxing instead of fighting me. I'm working with myself. And the bonus is that I'm training strength at the same time I'm training flexibility and creating balance across the joint.
So we're getting two things for the price of one, basically.
Two for the price of one.
So tell me about your technique. Active, isolated stretching.
Active, isolated stretching. The father of this is Aaron Mattis down in Sarasota, Florida. And
hey, Aaron, how you doing? If he's watching. I think he's watching.
I was a good student of his many years ago, and I still am. He's quite a sentient in this area. And he continues to teach and work, and he's just fabulous, and he mentors many people. So kudos to Aaron. He's great.
Aaron,
and what he discovered was that this stretch reflex, the body's contraction when it feels a stretch,
right,
can not only be inhibited by contracting the opposite side, but he found that the inhibition or the relaxation only lasts about 2 seconds.
Huh.
So I did pilot research in this area that backed this up. So when you can't hold a stretch, it turns out, because if you do, you'll be fighting yourself. So you get another bonus here. That is, when I contract one side, it relaxes the other.
Right.
I can only hold the stretch for about 2 seconds because after that the inhibition is gone and I'll be fighting myself. So I'll do slow, gentle repetitions and I'll pump blood in and out of the muscle tissue, bringing nutrition and oxygen in, taking waste out. I'll train strength, I'll train flexibility, and the most important part, I'll train strength in the range of motion that I'm developing, so I get to use it and keep it instead of I was flexible one day and not the next.
That's amazing. So basically, like, you know, when we stretch, the typical stretch of staying in that position for 30 seconds, we're doing more damage than good then.
Well, maybe if you're really aggressively stretching, you don't even know what you're doing because we do know you're fighting yourself. We do know blood flow is not optimized. If you're really pushing hard, you could be micro-tearing your tissue, which wouldn't be. You're putting in a neural pathway of a static hold instead of movement.
Right.
The research shows that actually is bad. When you hold that stretch, it's actually bad for performance, athletic performance.
Right. So what would you recommend athletes, for example? What's you know, a track and field runner or a you know, a sprinter or whatever? Those techniques would work well on them?
They work great because since it's a movement-oriented technique, it actually warms them up and sets neural pathways for their sport before they compete. After their sport, it restores the flexibility to their joints, clears the waste products, and brings nutrient-rich oxygen and other nutrients to feed the muscles after the sport. So it's everything they need for before and after their competition and during their training.
That's amazing. So like, and there's data that shows that holding a stretch for 2 seconds is much more efficient than doing our traditional 30-second stretch, right?
Yes.
Why isn't everybody doing it then?
We need to do broader research in the area, and I would love to partner up and do some larger studies in the area. It's mostly what this is physiologically correct, active, isolated, assisted exercise.
Right, right.
So you're doing everything in line with the laws of physiology. It turns out the old paradigm of stretching is what was violating the laws of physiology. And that's been proven in research most recently, actually, since the 1990s on up, to be detrimental to athletic performance and coordination and other things like that. So it's logical. It violates the laws of physiology. It works against your body, and it doesn't work in a research setting. Active isolated stretching has been shown to work in small studies. The pilot studies I've done in the stretch reflex support the 2-second hold.
Right.
And everything supports it as being correct, but most of all, it's the same as what you would call learning theory or constructivist learning theory.
Right.
I'll give you an example. I'm going to stretch my triceps again.
Right.
I do an action. I assist the action or potentiate it.
Right.
I rest, integrate the information, and repeat.
I see.
That's constructivist learning theory.
Wow.
So we're just doing what's absolutely correct for not only the body, but for the mind.
Well, I'm sure we're going to see a lot of that very, very soon. We got 1 minute before we take our break. Just tell me, like, those kind of stretches, the active isolated stretching, anybody could do it, and you know, if you had surgery, for example, back surgery, could you do that? Or should I say, is there limitations on that kind of technique on people?
Well, hopefully everybody can do it. We'd like to bring it to everyone because we think it's going to make people a lot more healthy. One of the things that makes it very safe is it's an active movement, and usually people don't go somewhere that hurts themselves.
Right.
If I'm holding a stretch, I might hold this to the point that I don't even know I'm hurting myself. If I'm doing an active movement, my body will tell me if I'm going too far and I'll stop.
Right.
So inherently, it's much safer than what you see this classical stretching. And it can be used, we use it post-surgical, we use it for rehabbing everything from stroke to ALS to athletes to performance enhancement of athletes.
Right. That's amazing. Well, we got a lot more coming back after the break with Dr. Jeff Haggquist. Stay around. Did you know that you burn more calories during the 23 hours you don't exercise than the 1 hour you do? What did I just say? Actually, your body uses more oxygen after a long and intense workout, which means your metabolic rate is higher, which means more calories burned throughout the day. It's called the afterburn effect, or EPOC. Sounds cool, no? So make your workouts more intense so you can keep burning those calories even while watching television. We are back with my friend Dr. Jeff Haggquist, and now it's my favorite time of the show, which is the viewers' questions. You ready, Jeff?
I'm ready.
Because they're tough questions.
Okay.
All right. Question number 1 from Carrie from Washington, D.C. Hey, Carrie. Her question is as follows. I had back surgery 6 months ago, and now I suffer from what doctors are calling piriformis syndrome.
Yes.
For our viewers at home, piriformis is a muscle that's, and correct me if I'm wrong, deep in the glute muscle. And what happens is the sciatic nerve goes either behind it, in front of it, and sometimes through it.
Yes.
Right? In some cases, when the piriformis gets angry and inflamed, it puts pressure on the nerve, which then you start feeling pain down the leg, etc. There you go. I have pain going down my leg, and it gets worse when I sit for long periods of time. What should I do?
There's a very specific stretch for the piriformis muscle. It's so specific, it has to be demonstrated to you.
Right.
Classically, it's done in a figure 4 pattern, like your legs are crossing, making a figure 4, and then you bring your leg up to your body.
Right.
But actually, that doesn't stretch the piriformis.
That's how people do it normally when you go to gyms. You know,
Yes.
they do the same thing. They either put it against a wall, get that push, or somebody else kind of helps them through the
That
stretch.
stretches the hip capsule, but not really the piriformis. So to stretch the piriformis is a little bit more specific. You have to isolate that muscle exactly. So not only do you have to lift the knee or the leg above the waist, but you have to cross the waist.
I see.
And then the femur acts like a rotational axis. And that is how you stretch the piriformis muscle.
Why would the piriformis get angry? Why?
Good question. In 14% of the people, you told us earlier, the nerve is not going where it's classically supposed to go. It might go through the muscle, it might split in half and go on either side of the muscle.
Right.
And then something they did, maybe they were doing some sort of exercise that irritated the muscle. Well, then the muscle irritates the nerve, and then it becomes a vicious circle.
Right. But it always starts with the muscle.
It can start with the nerve. The nerve can irritate the muscle, or the muscle can irritate the nerve. Either way, you have to break that vicious circle. So stretching the muscle out is at least part of it.
Now, this particular client said that she's considering Botox in her glute. Have you ever heard of that?
Yes.
And what do you think?
You can isolate the piriformis muscle, you can put Botox in it, and basically turn it off for several months.
Okay, so it's about turning the muscle off like you would on a face, basically.
Absolutely.
Freeze it.
And it would be diagnostic in that if it fixed the problem, it would be not a bad option. If it doesn't fix the problem, it wasn't really the problem.
Right. Botox in your butt. Who knew? All right, we have a second question from Edgar from Boston. Hey, Edgar. You like my Boston accent?
Yes.
I suffer from chronic plantar fasciitis.
Yes.
I've tried numerous techniques, including cortisone shots, night splints, insoles. My doctor is even considering stem cell therapy. Any thoughts?
One of the biggest variables in plantar fasciitis.
And if you don't mind explaining our viewers what plantar fasciitis is.
You have At the bottom of the foot, you have some tissue, some very thick fascia, which helps hold up the foot arch.
Yeah.
And it basically, it holds the foot stable. If the foot arch collapses, or if the gastroc muscle, the calf muscle, is too tight, it puts strain on this fascia.
So you recommend what? Stretches on the calf muscles, like typically could take care of that?
The number one variable in plantar fasciitis is a tight calf. So if we correctly stretch the calf, work with the calf instead of against it, we can actually take the biggest variable away from the problem and sometimes solve the problem. The biggest mistake is people put their hands against the wall, put their leg back,
classic,
and push all their weight into that calf muscle. Well, we already know the calf muscle is fighting with an equal and opposite force. And you're probably, I weigh 200 pounds, so I'd be micro-tearing my calf, irritating the plantar fascia all the time, and we're told this is what makes it better, but this actually makes it worse. So if we can do an active stretch, working with the body, with the gastrocnemius and soleus muscles, the muscles of the calf, many times we can greatly decrease the plantar fascia, break that vicious circle, and allow it to relax and heal.
So the active isolated stretching would help.
It's one of the main treatments we use for this. We use all of the above, and I've never used stem cell for it.
That's incredible, where we're going. It's unbelievable. So there you go. So the active stretching, active isolated stretching could help plantar fasciitis. Doing it on the calf muscle, right?
Sure.
That would be what, 80% of the time it would solve the problem. Doing that.
It will make a difference almost 100% of the time.
Wow.
How much of a difference depends on how committed you are to making the calf flexible again. I would say you could decrease the plantar fascia pain between 40 and 80% almost every time using the active isolated stretching.
Wow, that's unbelievable. A question from Carl from Bethesda. Hey, Carlito. I've had elbow surgery and now I have a tingling sensation and numbness going down to my hands. I see an acupuncturist which gives me temporary relief, but I'm looking for a more permanent method. Please help.
Well, there's a few ways that the nerves can be entrapped or compromised crossing the elbow. After elbow surgery, you can have scar tissue there. There is, as you get a little bit older, you can get something called cubital tunnel syndrome. There's a ligament called the ligament of Struthers in the elbow, which is very sharp, which the nerve wraps around. So after a while, you can irritate the nerve, especially if you sleep with your elbows bent at night. So the first thing I'd say would be learn to sleep with your elbows less than 90 degrees or open, because that might be the whole problem. Okay. The next thing I would do is stretch the muscles. For the conservatives, there's a lot of treatments, but the most conservative, cheapest, easiest, works the best would be to stretch the muscles that cross the elbow to reduce stress in that area. Of course, I would use an active stretching technique.
So which one would you use for that?
I can demonstrate it. So you have the muscles on top of the forearm and on the bottom of the forearm. To stretch the muscles on top of the forearm, I would contract the muscles on the bottom of the forearm, make a fist, contract these, help the stretch, relax, let blood flow back in, and repeat.
Oh, wow.
Okay.
I could feel it already. Just doing that.
Do this about 10 times, and after that, you'll see your range of motion will dramatically improve. Then just the next thing is do the opposite. Bring your hand up as high as you can. Help it do what it's already doing. 1,002, and relax. Bring it up. 1,002, and relax. You'll probably need to do a bunch more of these because the flexor muscles are usually much tighter than the extensor muscles because of all the typing we do.
I see. And you recommend doing this, every day?
Oh, I would do it 2 to 3 times a day. You can do it while you're on the phone or doing other things, so it really shouldn't take any extra time away from your day.
Beautiful. There you go, Carl. I think we got time for one more question. I can't believe time is flying by. We got Doug in Australia. Hey, mate. How you doing, mate? Kangaroo. I'm 45 and suffer from joint pain. I feel too young to feel that way. Any recommendations? My question is, like, is there such a thing as an old problem? Like, or through maintenance, could we live a whole life with no joint problem or problems that we would say, oh, that's an old person's problem?
Right. It turns out non-specific joint pain is a problem many people have who are extra flexible. The reason they're flexible, so what happens is their joints are extra flexible and their body doesn't like the joints being out of place, so it tends to tighten up their muscles to try and protect their joints. So they get what's called paradoxical or opposite inflexibility, paradoxical inflexibility. They're actually naturally flexible, but they become inflexible because their body is protecting their own joints. So if you put their joints back in balance, it's very important for them to become strong.
Right.
So if he is an extra flexible person, it would benefit him very much to do a lot of very balanced work with trainers and do programs such as your own, and in balance, get your posterior chain strong. Create balance across your joints. If there's flexibility and balance, then we would use an active flexibility method like active isolated stretching, because then we would kill two birds with one stone, train strength and flexibility simultaneously.
Right. Well, that's it. You don't have to get old and get like all like joints hurting or anything like that. That's all the time we have. I can't believe it. I have so many more questions to ask you. You know what that means, right?
Yeah, you have to come back.
That you have to come back. Thank you for being here, Jeff. I appreciate it.
Yes, sir.
Thank you so much for watching. And remember, life is beautiful. Live it to the fullest and have a big smile on your face. I'm Laurent. Et à bientôt.